The high yielding topic for this NEXTFELLOW reels is scalp swelling in newborn. Now these scalp swellings, they mainly occur during delivery of the child, and it happens due to bleeding or edema which happens into various locations within the scalp and the skull. So this is a figure which shows the different layers of the scalp and which shows the lesions which we have to know about. Okay, first is the caput succedaneum. As you can see from the figure, it happens in the subcutaneous plane, and then there is cephalohematoma, which is actually very important, and the cephalohematoma it actually happens within the periosteum. Okay, and then there is subgaleal hemorrhage, which happens between the scalp aponeurosis and the periosteum. What do you need to know, or rather NEETpg? Okay, first thing you have to learn is caput succedaneum. It is a fairly common lesion. Approximately 40% of newborns have, and it can happen due to prolonged labor, where the child's head is trapped in the birth canal for a prolonged period of time, and even after vacuum deliveries. And it happens in the subcutaneous plane, and the content is edema fluid. It is seen immediately after birth, and it is benign in nature, which usually requires no treatment, or rather requires no treatment, and starts disappearing within the first 48 to 72 hours of life. It is diffuse in nature. It crosses the suture lines. It is diffuse and crosses the suture lines, and no significant associations are there. Complications itself are rare, but still for exam purpose, secondary infection, necrosis, and an extremely rare sign, halo ring scalp skein. Okay, and it happens above the periosteum. Next is cephalohematoma, which is less common, and it happens after a forceps or vacuum delivery. It is seen over the occipito-parietal areas of the baby, and the content is blood. It is seen only after 24 hours of life, and it is mostly benign in nature. It can persist for 3 to 4 weeks or even up to 6 weeks, and then resolves on its own. It does not cross the suture lines. Okay, it has well defined margins. Okay, so that is a characteristic feature of cephalohematoma. It is associated with newborn jaundice and sometimes linear fractures of the skull, complications being secondary infection, calcification, and rarely osteomyelitis. And it happens due to rupture of vessels beneath the periosteum. Next is subgaleal hemorrhage, which is a rather important upcoming topic which you should be aware about. It is a rare condition. It happens due to excessive traction on the scalp. It occurs below the subcutaneous plane. Content is blood without a doubt, and it happens immediately after delivery, or it can slowly enlarge, and it can progress over a period of days or hours, and it is a diffuse fluctuant swelling which carries a high rate of mortality, or it is fatal. Okay, it can be fatal. Okay, and the complications are shock, hypovolemia, and even death. Okay, and it happens due to trauma to the emissary veins between periosteum and the scalp aponeurosis. And if it is there, we have to treat by PRBC, IV fluids, and evacuation. And this is a figure so that we should just go through the three conditions again. First is caput, it is there, and subgaleal hemorrhage between the aponeurosis and the periosteum, and cephalohematoma inside the periosteum, and caput succedaneum just beneath the subcutaneous plane.